healthy living with Intermountain Healthcare.
Having a baby can bring a new mother excitement and joy, but on the flip side for some, a new birth can also trigger fear and anxiety. Sarah Seymour from LDS Hospital Behavioral Health Access Center joins me now to share symptoms of postpartum depression and anxiety. And Sarah, I love that we are talking about the anxiety aspect of it as well, because that's definitely something that I see heightened when I have just had a baby and in the months after a baby. So talk a little bit about that.
So we always talk about postpartum depression, and we never really talk about postpartum anxiety, and they really are coupled. And what we can see is because of the postpartum depression, moms can be incredibly worried that something is always wrong with their baby. They might be concerned that they're not doing all the things that they are supposed to do to help the baby. They could be, just afraid of things that are irrational, that they normally would not be worried about.
The mothers, like I am, that are waking up in the night setting alarms to check on their baby's breathing. Would you say that is something that most mothers are doing, or that could fall more into the postpartum anxiety?
That's something that, it's okay to do. We know that there's medical reasons to do that, but if it's happening every 15 minutes or 20 minutes, that's excessive. And we want the mom to get as much rest as possible so that she can be present for the baby.
So if someone has recently had a baby, how soon or how late can these symptoms kind of set in?
So it can be anywhere from, within the first day or two. Sometimes we will see they don't manifest for a few weeks or even up to a month.
So what are the main things for people at home that you would have them be looking for?
So if you notice that you're checking things over and over again, like we were saying about the monitor, or whether the baby's hot or cold or sick, if, the mom is really worried that she is not treating the baby the way she's supposed to, if she finds that she's not talking about all of the concerns and anxieties that she has, that she's trying to suppress them, those are things that we would definitely be worried about and want the mom to try and seek help for.
So at what point should moms be seeking help? At what point is it just sleep deprivation? It's overwhelming to have a new baby, whether it's your first or your fifth. So at what point would you tell mothers or their spouses or their partners that it's time for them to check in?
So if we see a woman who is having a psychosis, if she is afraid she might harm her baby, if she's having self-harm thoughts, if she's in a severe depression, or if she's feeling rage, all of these things can be part of the depression and the anxiety and obsessive compulsive thoughts.
So what should she do if she is feeling those symptoms?
She should either come to the LDS Hospital Access Center, which is a walk-in center, 10 a.m. to 10 p.m., or go to the emergency room. Especially if she's in a psychosis or feeling suicidal or homicidal, ER's fine. Absolutely.
I wouldn't have realized that.
Yeah.
That you could and should go into the ER. You aren't just calling your OB and waiting for them to call you back.
Absolutely not. No, we treat this very seriously, and we want her to get help immediately.
And what are ways this can be treated when they come in?
Well, there is medication that can assist, and one of the things that severe anxiety can provoke is a feeling that the medication will harm the baby if she's nursing. So we know it's safe. She needs the medication. Bonding with the baby is the most important. Secondary to that is to receive therapy, hopefully on a weekly basis while she gets through this difficult time.
Well, you've said you've seen an increase of this here in Utah over the past few years.
Yes, since the Access Center opened, we've noticed that it's easier for women to come and get help because it is a walk-in behavioral health center. You don't need an appointment. It is open from 10 a.m. to 10 p.m., so it's easier for people to come and see a social worker, see a psychiatrist, talk about medication, and then get set up with ongoing outpatient support.
Such a smart way to do it, because when you have a newborn, it's hard to make an appointment. It's hard to know what the next 30 minutes will entail. Thank you so much, Sarah, for being here today. For more information, we have it up on our screen. Also, the number for that crisis line. And once again, the walk-in hours daily, 10 a.m. to 10 p.m.